Hey, what's up, everybody? I wanted to do a video on my experience this morning. I frequently get asked, by friends, family, about what is medicine going to be like. And as much as I want to be very positive, I'm very honest with them and I tell them I just simply do not see it getting better from a system standpoint. This morning is a great example. So, I'm going to talk a little bit about the effects of prior authorization. Prior authorization meaning that I order a test, I order a treatment, medication, and essentially, if you have an insurance company, they have policies, they can say yes or no. Part of the policy is that I have to go ask their permission, and then they give me a decision. So I have a particular patient that I've been working with for several months on their shoulder pain. They did over-the-counter medications, they did rest, and then they eventually saw me. So I did my evaluation, did an ultrasound, started them off in physical therapy. They weren't responding. I brought them back a couple weeks later. I did an injection for their shoulder. I got a positive response. However, it came back again. So my ultrasound evaluation did show me some findings, but ultimately I wanted to get an x-ray just to make sure, because ultrasound is great for a lot of things, but you can't see everything. So got the x-ray, brought them back, and I wanted to get an MRI, but I tried one other type of injection in a different spot to rule out where the source of the symptoms could be. And so again, they got partial response, but it wasn't as good as the first one. Now, at this point, I have a good idea of where the pain is coming from, and now I can get an MRI and tell the radiologist that this is specifically what I'm looking for. Now, I put in a referral for the MRI. I fax it. I fax it to a local imaging center. The imaging center, first of all, says that they don't have my referral. And I very clearly faxed it, so I refaxed it again. Eventually, I get a call back from the imaging center saying that I'm going to need prior authorization. So I said, fax me back the note, because the insurance company never sent me a denial letter. And so very clearly on the note, it says you have to do physical therapy, you have to do other types of conservative management, injections, so on and so forth. And I said, well, I already did that. So I refaxed the information as an appeal with the supporting information, which is what I did the very first time. So I refaxed it again. I get a denial again. And the justification for the denial is basically saying that they don't have enough information. So at this point, I've done pretty much everything. The next step to do is to call them formally again and set up something called a peer-to-peer. Now, peer-to-peer is not always a quote-unquote peer. I'm a physical medicine rehabilitation specialist, board certified in sports medicine. The person that I'm talking to, that I'm basically running my case through and who is going to have the ultimate decision, doesn't always have to be the same specialty. So I've talked with obstetricians, internal medicine, I've talked with psychiatrists, people completely out of the field, but their role is to follow policy. So as much as I've tried to get upset with them, like we all have, because it's a frustrating process, it's not their fault. It's the insurance policy, and they're just doing their job. So I call up this third-party administrator who is essentially mediating the denial. So I'm not even actually talking with the insurance company. I'm talking with a third party, an intermediary between me and the insurance company. And this third party is the one that I'm now talking to specifically, and who's going to administer the insurance's policy. Call them up and they say, hey, you have to do a peer-to-peer. I said, yes, let's do it. Sometimes you can get them on the phone, sometimes you can't. So they said, well, we can set up an appointment for later on this morning. So they call me back, which I appreciate. Sometimes they do, sometimes they don't. And so they call me back. I talk with the physician. They happen to be an orthopedic surgeon, which is great. And, they're very nice. They say, hey, how's it going? I'm, Dr. So-and-so. I'm here to review the case. Can you verify the information? So again, this is all taking time, right? So they say, okay, looks like you're looking to get an MRI of the shoulder. Looks like you've done physical therapy. Looks like you had an x-ray. It looks like they're not improving. Can you verify this? And I said, yes, that is true. And they said, oh, okay. Well, then here's the authorization. And so they give me the authorization, and so they can get the MRI. Now, that's great for the patient. I'm happy to do that for my patients. However, this took an hour out of my morning, and I'm happy to do it, but I have a direct care practice where I have time to do this kind of stuff. Now, you imagine with an insurance-based model where your physician is seeing 25 to 40 people a day, right? And so to basically take the time to set up a peer-to-peer out of that busy person's day, like, it's just difficult. And they have working hours. So even if you're going to ask the physician to do a peer-to-peer after hours, the people who want to do the peer-to-peer also really only work between 9 to 5. So even in the most compassionate situation where the person is like, hey, I want to advocate for my patients, I'm going to do this at 8 p.m. tonight, you can't, because that company does not work at that time. So the trickle-down effect of this is, now this took me an hour to get all the way through. It was a headache, right? And so let's say another patient comes through and I'm thinking they might need an MRI, but do I really want to go through this again? And the unfortunate truth is that that whole negative experience kind of changes your physician's or whoever's ordering your test. It affects their decision making in the long run. No one wants a negative experience, and as long as insurance companies make all of these interactions negative, they know that physicians are going to stop asking for MRIs because the prior authorization process is so painful. And wouldn't you know it, that's less money out of their pocket, right? So at the end of the day, we'll always say, well, it's your physician's decision to order the MRI. If they don't want to order it, that's up to them. Or you have to get them to do it. So you get a physician who is trying to do the right thing, and they are given several hoops to jump over just to do the right thing. Like, I think if you have the time and the compassion and the mental bandwidth to keep doing it, you'll do it, but it's draining. So all of these barriers that insurance companies throw at us, it ultimately will affect you, the patient. It's unfortunate. I just don't see the insurance companies making it easier. I've been doing this 10 years, and the red tape has gotten worse, even in the past 5 years. Even in the past month, I've gotten a ton more prior authorizations, ton more denials, and they will eventually overturn the denials, but you have to be really working at it. At the end of the day, I just don't see the system changing. There's no incentive for these insurance companies to change their policies. They continue to make money the way that they're functioning, so why would they change? There is no incentive for them to change. And that really comes back to the patients, to the consumers of their product, which is the insurance policy. You guys need to be aware of their practices so that you can learn how to take care of yourself. I think we're at the point where you have to be advocates for yourself. You need to start looking for alternatives to receiving the care that you need, because when you see a physician that is within the insurance model, their hands are tied. They have to follow those rules. They sign a contract to follow those policies. So they are tied to that and all of the headaches that come along with it. How the insurance policies are affecting the people that are taking care of you. And again, this is not to draw empathy. I'm just saying it affects the decision-making process. So, there are a lot of physicians that have opted out of the insurance-based model, which is ultimately how my business started. I just kind of got tired of it. The policies that we all have signed up for, they don't translate into good quality care. A physician needs time in order to take care of their patients. It's just as simple as that. When you're an insurance-based model, you have to see 20 plus patients a day, 30, 40, in order just to keep the lights on. And that just never really resonated with me. Seeing 40 patients a day, I can't spread myself that thin. The quality will tend to wane. So the point of this video is you guys need to know what goes on. When you hear the term prior authorization and burnout, it's not just like a simple it's a checkbox that they have to check. It is flat out ridiculous for me to spend an hour basically to have someone go through what I've already demonstrated in my notes and just read my notes back to me and just say, there you go. If anything, there is going to be more scrutiny. There's incentives given to these third-party administrators to deny. So, why wouldn't they do this? Especially now with AI, there's going to be tons of denials. I'm just letting you guys know this so that you guys can prepare yourself. The way around it is to go outside of insurance. If you're trying to get an MRI, you're trying to get certain treatments, unfortunately, knowing the cost, who has the best price in town, who's actually good, this is where the conversation needs to go. And I'm not against insurance, because everybody that I'm treating in my practice, I would say 99% of the people I'm treating have insurance. So I work with them. But because I'm outside of the insurance-based model, the way that my practice is structured, I can deal with it. It's frustrating, but I have the time, I have the mental bandwidth to deal with it. But not all physicians have that bandwidth. And so, again, I'm not here to say take it easy on physicians, give them a break. I'm saying you guys need to come up with a plan. Play within this system, because that's what I'm doing. Even though I'm technically in the system, I'm still in it because I take care of my patients. My patients have this policy. I'm trying to maximize their benefits as best as they can. I'm not trying to do extra work. I'm not trying to make them do extra work. But at the same time, because I am out of network, I don't have to play by their rules. However, because my patients carry that policy, there are still rules that they have to play. And so, again, 2025 has been a very interesting year in the healthcare industry. Please make sure to start paying attention to your healthcare policies. Start identifying people in your community that are willing to go through all of this for you. I think that's even in my own health, even in taking care of myself, I have to find physicians to take care of my family that have these type of values, that know how to play the game, know how and when to prioritize their time so that they can serve their patients. Even as a physician, I'm actively looking for people to do that because it's simply hard. But that being said, just stay vigilant, keep your eyes wide open. These policies are changing, the premiums are going up higher and higher. I'm worried for our patients. Right now, I found a way where I can still practice in a model that's different from the current system. So I encourage you guys to look for alternative models of care. Thanks again.